That's right.
Thank you very much. Taoiseach, the debacle which was caused by the National Ambulance Service over the past weekend has to be seriously investigated. The NAS caused fury in Cork County and Kerry when they announced further reductions of services covering these areas. This effectively was leaving no ambulance cover for Skibbereen area Monday by day, no service in Castledownbere Tuesdays, no day service in Clonakilty and Bantry on Thursdays, and every second Tuesday night no services in Bantry. Also losses of day services were announced for Mallow on Monday, Mill Street on Tuesday, Macroom and Fermoy on Wednesday, Kanturk on Thursday, all announced with no consultation with staff or public by the NAS. This was nothing short of a stunning blow to these communities, which I may add, they did not take lying down and came out fighting. This decision was reversed yesterday after some swift action by us all, but leaves many questions unanswered. Our ambulance service workers working incredibly hard as they continue to save lives under enormous pressure 24/7, but morale amongst ambulance staff is at an all-time low. 5 staff with 20 years experience and 2 graded advanced paramedics have left the service in the Cork County area over the past couple of weeks. The current rollout of the ambulance service now and in the past few years has been reduced daily to an ambulance chasing service, basically getting to people's homes 3 or 4 hours after a call. When the patient's gone, as families could not bear to see a loved one lying in agony, so they take the patient in their cars or whatever transport they can find. Never a week goes by when I hear some sad and shocking stories of loved ones left waiting hours and hours for an ambulance. Only last Friday, a GA player near Cork City laid on a pitch with a suspected spinal injury for up to 2 hours waiting for an ambulance. A recent report published less than 2 weeks ago showed clearly that Cork was the worst affected area in the country, already in the state, for high priority ambulance calls that took well more than an hour to get to a patient. And instead of the NAS, the Department of Health, or the Minister for Health intervening, then, to put the shocking situation right, they instead almost grinds the service to a halt. I give you a rough idea how the Castledownbere ambulance works. This is just one. Already it covers Castledownbere Peninsula, which is huge. It also sees out the parts of Kerry, Kenmare, etc. It covers up as far as Newmarket and Cork, and all the way down to Goleen and Kilcrahan in West Cork. So this ambulance gets a call to Newmarket, and when they get an urgent call to Goleen, the fastest they can make it is 2 hours, 6 minutes. This ambulance, which is meant to be in Castledownbere, looking after those people, if in Newmarket gets a call to Argroom, the quickest it can make it is 1 hour, 44 minutes. And that is if they do not have a patient on board. If they do, it's another hour plus to each area. Taoiseach, I'm saying to you that heads have to roll at the National Ambulance Service. How can someone at the top who has mismanaged the ambulance service for years can still cause further havoc and walk away as if nothing has happened? The current ambulance service with people waiting 2, 3 to 4 hours is an appalling service, and I'm asking you on behalf of every person in our communities in this country to demand from the Minister for Health for him to introduce a new model ambulance service to the public that can respond to emergencies in less than 1 hour, no matter where you live in this country. Your life, Taoiseach, in this country should not be determined by where you live.
Thank you, Deputy. Taoiseach.
Well, thanks very much, Deputy Collins, for raising the matter. The Minister for Health became aware of this, I think, on Monday morning. The Minister for Health had intervened, as you're requesting, I think by Monday afternoon, to resolve this matter. Once this was brought to the Minister's attention, he took swift action. I commend him for that, because this never should have happened and was never the intention that it would happen as well, because as a government we have significantly increased investment in the National Ambulance Service. In fact, we've increased it by 37% since 2019. In other words, we've increased it by €63 million. The budget for the National Ambulance Service for 2024 is €231 million. When it comes to staffing levels, there's 419 additional staff working in the National Ambulance Service now than there was at the end of 2019. So tens of millions of euro of additional funding, hundreds of additional people working in the National Ambulance Service is the record of this government in terms of investment in our ambulance service as well. It is true though, and I would like to receive those cases that you referenced there, because I think it is important that you highlight them, and I thank you for doing that, and I'm sure we would ask the National Ambulance Service to consider them in the context of how they meet the needs of our patients. The National Ambulance Service does continue to experience significant growth in demand. I think 398,000 calls were received from the public last year, which is an increase of around 14% on 2019. But despite year-on-year increases in demand, the National Ambulance Service has improved service response time further this year for what they call purple, which is cardiac life-threatening, and red, which is life-threatening call responses. And in fact, they've actually exceeded their own KPIs published in the HSE National Service Plan so far this year. So they have They gave a commitment in terms of response times. They have exceeded that commitment, and they'll continue to drive service improvement. To be very clear, the Minister for Health, the government, were absolutely keen to ensure that there's no reduction of emergency response ambulance services in Cork and Kerry, and I regret that there was legitimate concern around that earlier this week before the Minister intervened, and the Minister is instead examining ways to ensure welcome back, is examining ways to ensure that funding is provided so that frontline services can, of course, be maintained, and we'll continue to work with deputies in Cork and Kerry on this matter.
Taoiseach, thank you for your reply. You said that it should never have happened. This is what's happening on a weekly basis in Cork County. And from what I hear, it's happening on a weekly basis nationally. You need to step in here immediately. The public in Cork County and City and nationally deserve a 7-day ambulance service and nothing less that they can access in no more than an hour when required. There is a crisis in the ambulance service nationally, and it very much looks like, after last weekend's chaotic decision, that it is headless chickens are in charge of the service. There is no confidence in the senior management structure of the NAS, and as I have said, staff morale is at an all-time low, as has ever been seen in 20 years for those who are working there. General managers are dancing to directors' tunes and completely ignoring staff and patients alike. There needs to be a complete wipeout of the present NAS senior management, who are so caught up with power they disregard the mention of patient or patient care. Anyone who came out last weekend with cuts after such a grim report published 2 weeks previous must be removed from their positions immediately. It's been widely said in Cork County, if this was not an election year, this decision would not have been reversed. I ask you again, Taoiseach, will you intervene immediately in this crisis, as the clock is ticking on people's lives, and help build a new ambulance service that staff and public can have confidence in?
Thank you very much, Deputy Collins. Taoiseach, to conclude.
Well, just to be clear, because with respect to you, and I appreciate you raising an important issue, but you gave a view in relation to confidence, and nobody has confidence, etc., etc. I have confidence in the head of the National Ambulance Service, Robert Morton. I have confidence in the management of the National Ambulance Service. I have confidence in the people working in the National Ambulance Service, and I base that. Thank you for your intervention. And I base that on the fact that when people give commitments to what their targets are going to be for the year and exceed the commitments, that is a good sign. So you talk about the cases, and you're right to highlight them, Deputy, and I don't in any way dismiss them. But when it comes to the published KPIs for National Ambulance Service targets for purple and red calls, life-threatening calls and cardiac life-threatening calls, the National Ambulance Service has exceeded those targets. And to the end of July, 76% of calls in the purple area were being responded to within 19 minutes. So I can understand when something goes wrong, you want to highlight that case, and you should, and we should continue to improve services. But this is an area where we have actually genuinely improved service times. There's a lot of innovation going on in the National Ambulance Service. New services, the use of advanced paramedics, new training models, and we'll continue to invest and support them and look forward to doing more in the next HSE service.
Thank you, Taoiseach.